my name is Melissa Weems, and I'm going to be doing a presentation on asthma. I'm going to go over the pathophysiology of asthma, as well as the medications used to treat asthma, the side effects, things that will trigger an asthma attack. We're also going to go over health promotion within the community so we can help adults and children who live with this awful disease live the best life that they possibly can.
So what is asthma exactly? Asthma is a chronic disease that affects the lungs. It's an inflammatory response that causes the airway to narrow. Asthma causes the airflow obstruction, and so it's hard to get air through. There's actually no cure for asthma. The goal is just to decrease the risk to exposures. As you can see from the first drawing on the left, that's a normal airway of a person. The middle drawing is an airway of a person who has asthma, whereas in the final drawing on the right is an actual airway of someone having an asthma attack. As you can see, the person that has asthma already has a narrow airway, and when they're under an actual attack where they're exposed to different triggers, their airway is even more narrow. This picture is an actual demonstration of the pathophysiology of asthma. As you can see at the top, there's an allergen. The allergen is going to cause all of these different types of cells to have an inflammatory response. These cells, in turn, cause the airways to have an inflammatory response, which then causes the airway to actually obstruct or narrow, which then causes someone to have trouble breathing or have an asthma attack. Asthma has 4 different classifications: mild intermittent, mild persistent, moderate persistent, and severe persistent. Depending on the severity of the symptoms and how often they occur depends on how one's asthma is actually classified. Obviously, mild intermittent is the least severe, whereas severe persistent is the most severe, where these people have continual daily episodes as well as frequent night symptoms of asthma. Common signs and symptoms of asthma include coughing, which is often many times worse at night or early in the morning, wheezing, which is just that little squeaky sound that you hear when people are breathing in and out. Often they feel tightness in their chest as like an elephant sitting on it, as well as they just have general shortness of breath even without activities. There are many risk factors and triggers to asthma. Things that are out of people's control include an genetic predisposition, airway hyperresponsiveness, gender, ethnicity. African Americans are more prone to asthma, early viral infections. Environmental factors that we do have some control over include indoor allergens such as pets, outdoor allergens such as pollen or different things in the environment, occupational sensitiviers, smoking, respiratory infections, and diet. Then there's also triggers, so allergens, certain drugs can trigger asthma attacks, stress, exercise, cold air. The most important thing is for people who have asthma to be able to know what their triggers are for an asthma attack so they can avoid those triggers. For example, if you know that cats cause you to have an asthma attack, the best thing you can do is not be around cats. Asthma is one of the most prevalent chronic conditions and affects approximately 300 million people worldwide. According to the CDC, within the United States in 2014, 8.6% of the children in the United States had asthma and 7.4% of adults had asthma. As you can also see from the graph, females are more likely to get asthma as well as the African American population. There are many different types of medications to treat asthma. The 3 basic categories for asthma medications are relievers, controllers, and preventers. The next several slides will actually look at the specific medications and their side effects. The relievers are also the group of drugs that are also known as the rescue drugs. They're the ones that are used for someone who is having an asthma attack or who is about to exercise and they want to prevent from getting an asthma attack. One of the groups of medications used are the short-acting bronchodilators such as albuterol. The side effects of these medications are acute infections of the throat, racing heart, nausea, vomiting, shaking, and nervousness. The anticholinergics can also be used as rescue inhalers. These side effects of them include dry mouth and increased wheezing. The controllers are your long-acting bronchodilators. Examples of these medications include Advair or Salmeterol. They're used to provide control over the asthma symptoms. Side effects of these medications include hoarseness, throat irritation, headache, rapid heartbeat, dry mouth, and upset stomach. The last group of medication used to treat asthma are your preventers. These are your inhaled corticosteroids. They're used to reduce the inflammation in the airways, and they're used for more long-term treatment. Some side effects of these medications include sore throat, cough, fungal infections of the mouth, decreased bone thickness in adults, increased pressure in the eye, or decreased growth in children. One thing to keep in mind is anytime you have a very specific medication you're using, always ask for the side effects of that specific medications. The side effects that have been listed are general side effects for that classification of medication, not side effects for each individual medication. As a healthcare professional, what can I do to help prevent asthma? Well, unfortunately, the actual disease of asthma is not preventative, but what causes asthma to be so severe as far as the asthma attacks and the triggers can be prevented. Being sure you know what your triggers are and keeping people away from those things that trigger their asthma attacks is key to prevention. Important things to look at with preventative measures are have an asthma management plan. Know your asthma triggers and try to prevent the exposure to them. Take your medications as prescribed. Track your asthma attacks and know when signs are getting worse so you can let your doctor or healthcare provider know. Also, knowing what to do when your asthma is getting worse. And another big key to just about everything is always, if you are a smoker, please stop smoking. Or if you are around secondhand smoke and you have asthma, avoid being around secondhand smoke. So how do we as healthcare providers know if your asthma is getting better? You need to keep track of your asthma attacks and symptoms. If the symptoms are decreasing and the attacks are less frequent, then obviously the treatment regimen you're on is effective. You can also take pulmonary function test as well as peak flow monitoring to see if there's an improvement in your actual pulmonary function. So what can we as healthcare professionals do to promote healthy living for someone who has asthma? We need to educate them. We need to teach them all about what they need to do. Have them have a asthma management plan. Teach them about their medications and the side effects. We need to make it fun, especially if it's kids. We need to visit local schools. We need to have health fairs. We need to promote a healthy diet, exercise, and lifestyle choices. We have to be able to make this awful disease livable for people and make them understand that if they can manage their triggers and manage their lifestyle changes, that they can make this disease very livable and live a great and wonderful life. I thank you for your time and hope you enjoyed this presentation. Have an awesome one.